Hi, this is Randy Wykoff, the Dean of the College of Public Health at East Tennessee State University, and I'm pleased to provide this week's update on COVID-19 for the week ending March 4th, 2021. This week I have three questions. The one I always ask: how is the pandemic progressing globally in the U.S. and in our region? Second, what do we know about the new J&J vaccine? And third, can we finally start to loosen up our restrictions? So in terms of the pandemic, we've now passed 2.5 million deaths worldwide, almost unimaginable 100 million cases, 3% increase in the past week, which is a bit down. But I want to remind folks that even at 3% increase, that's 76,000 deaths last week, over 7 deaths every minute. If you look at the week-to-week percentage growth rate, you can see that it's down nicely. It's been coming down. But this pattern that we see, it's going up and down, is not yet as reassuring as I'd like to see it. In the case of the United States, we've passed 500,000 deaths, 2.8% week-to-week increase, a little bit less than the rest of the world, which is a first. We've been ahead of the world in our percent growth. But even at that rate, there's 14,000 deaths last week. It's over 2,000 deaths a day, which is 1 death every minute. So even the percent week-to-week growth rate is coming down. Again, we have to remember this cyclical pattern of going up and down, up and down, up and down. In terms of where the cases are in the U.S., this is every month from August to February, and then I'll update it to March, August, September, October, November, December, January, February, that's February 14th and March 3rd. And you can see the cases largely in the rural south and in this area east of the Rockies and then in the southwest, where cases have been in the last 2 weeks from August, September, October, suddenly starting to explode in November, December, January, February, and now clearing up in March. So we are seeing less cases in our region. Again, for the first time, not for the first time, but now for several weeks, we haven't been one of the heaviest hit areas. In terms of the states in our region, the number of deaths is quite different, but if we look at deaths per million, we can see that Tennessee and South Carolina are still about 50% ahead of the other states. In terms of the week-to-week change, though, we're seeing something that's a little worrisome. All of the numbers are pretty low except for Virginia's. And this is the second week it's been in double digits. Last week it was about 12%. If you look at the pattern in Virginia, you see this sharp incline. I'm not sure that that's real or whether it's a reporting error, but it's certainly something we're going to keep our eye on. In terms of the ballot health service area, there have been 1,882 deaths. 3.6% increase in the past week, a little more than the U.S. overall. But even at that, I want people to remember that's 66 deaths last week. That's 9 deaths a day. So this is still a serious pandemic. And while it appears to be slowing down, it hasn't by any means gone away. We're fortunate now to have a third vaccine. On February 27th, it became the third one approved for emergency use. It's not fully approved. It's what we call an emergency use authorization. It's a different type of virus. The other two have been what we call messenger RNA. It's given as a single dose. The other two are given double. It was studied in about the same number of people, about 40,000 participants. The most commonly reported side effects are pain at the injection site, headache, fatigue, muscle aches, and nausea. And the vaccine was about 67% effective in preventing moderate to severe and about 77% effective in preventing severe disease. If you look at the pattern of cases over time, again, it's a single dose vaccine. And you can see it's a pretty, the blue is the vaccinated and the red is the untreated. And you can see many more cases there. But it's not quite as impressive, I think, as the Pfizer and the Moderna numbers. But we'll have to wait in time and see. There's some real advantages in having a single dose vaccine that can be widely available. So now we have 3 vaccines. We expect the number of people getting vaccinated will go up pretty quickly. So with everything slowing down and 3 vaccines, can we finally start to loosen up? People look at this drop over here and say, thank goodness we're finally slowing down. But I want to show you something. We actually are having about the same number of deaths every day as we had back in March and April when this pandemic first exploded in our country. And while we're less than we've had the last couple of months, we're still way ahead of where we were over most of the summer. But I also want to remind us that the pattern of this pandemic, this epidemic in our country, is it goes up and down, up and down, up and down. And what we don't know is whether what we're seeing is going to be a continuous downward trend or not. If we look at the four most impacted countries in Europe, we see this pattern where there was this spike in cases in March and April, and then very few deaths, spike in deaths, very few deaths over the summer, and then a second spike. Now, obviously, they didn't have the advantage of having a vaccine, but we can't assume that we're not going to see something similar in this country. And so while we can be very optimistic now that we have 3 vaccines, we simply don't know what's going to happen. We don't know what the natural history of this virus is. We don't know whether it's going to mutate. And so for the moment, we need to continue doing the things we know will make a difference: wearing masks, social distancing, avoiding crowds, now getting vaccinated, and taking the other actions that we know work. Again, I don't want to be a discouraging voice, but I also don't want to declare victory too soon. We're still seeing a couple of thousand deaths a day in the United States. We're still not out of the woods by any means. And if we were to loosen up too quickly, we could actually allow the virus to mutate and get worse. So I'm encouraging folks to continue doing the things that we know work. So the pandemic appears to be slowing down. We're very fortunate to have a 3rd vaccine, but it's not yet time to loosen up. A great deal more information about COVID-19 on the College of Public Health website. If you know anyone who'd like to be added to this mailing list, please forward this email to them, this recording to them, and ask them to contact Jan Stork and have themselves added to our listserv. As always, I'd like to thank Melissa White for helping collate the data and Dara Young for editing, producing, and posting this video. If you have any questions about what I've said today or things that you'd like to see me address next week, please let me know. I look forward to hearing from you. Until then, please be well.